Okay, Tara. All right, good afternoon and welcome everybody to our Firefighter Cancer Seminar Series. We're going to give just another minute or two for folks to trickle into our seminar virtual room, and we'll go ahead and get started. So please make yourself comfortable, and then we'll get started in just another minute. Okay, so it's 12:05 and we'll go ahead and get started. So welcome and good afternoon to the Firefighter Cancer Initiative Seminar Series. This is our last series for the year, for year 7 of the Firefighter Cancer Initiative. And we're closing out with a bang with a good colleague that we'll introduce to you now in a minute. For this session, we ask that you please make sure to any questions that you want to ask of our speaker of the science, to please be sure to use the Q&A function below on your Zoom platform when you join there. It is my privilege and honor to introduce to you this afternoon Dr. Patrick McGrath, who joins us all the way from Canada, is actually broadcasting live here from the University of Miami Sylvester Comprehensive Cancer Center. Dr. McGrath is a clinical psychologist and a senior health administrator and scientist and social entrepreneur. His major career goals have been to use research to improve healthcare. Dr. McGrath and his team have recently been funded by the Canadian government to initiate a research study, a very unique one, with volunteer firefighters on cancer prevention. And he's joining us today to be able to share with you some of that work in progress. So we're incredibly excited to have Dr. McGrath, and please take it away.
Thank you very much. It's quite a privilege to be here. I've learned a lot in just the few hours that I've been here. And I will be spending the rest of the day here and learning more. I want to tell you about our project on firefighters preventing cancer, funded by the Canadian Cancer Society and the CIHR, the Canadian Institutes of Health Research. It's a primary prevention of cancer competition that we entered. It was a proof of concept grant, small grant, 1 year, about 200,000 Canadian dollars. And the overhead in Canada is paid separately, so overhead doesn't come out of that. We did well in the competition, and the reviewers were extremely positive. And we were actually quite surprised that we got the grant, because we were putting in a grant with no validated measurement and no preliminary evidence for the intervention. And so I'm going to tell you about what we're doing. First of all, the most important thing is we made a very strong partnership with the Canadian Association of Fire Chiefs, or CAFC. They represent the 3,500 fire chiefs in Canada. And at the same time as we got the grant, they formed a cancer committee. There were 4 members of our scientific team on, and 7 other fire chiefs. And our grant reports through this committee to the CAFC. So this is a type of what we call integrated knowledge translation, much like people do here in Miami, is that the grant is held at the university. In this case, it's the University Hospital, and the scientists from Dalhousie and Laval University, and 4 members of the science team came from the Canadian Association of Fire Chiefs. So they were involved from the beginning with identifying the issue, formulating the measurement and intervention with the scientific team, development of all the materials, recruitment, and then be involved in dissemination. So the team we were extremely lucky to get this team together. Myself, Tina Saradine, who is executive director of the Canadian Association of Fire Chiefs and has a PhD in health policy, and she's also an adjunct at the Telfer School of Management at the University of Ottawa. John Lee Wang, who's an epidemiologist. Graham Pollitt. Graham is the chair of the CAFC Cancer Committee. He's in British Columbia, and he's a board member of the Canadian Volunteer Fire Service. Elena Laroche, who had written a meta-analysis of summary of meta-analyses on epidemiology, is a behavioral scientist at Laval University in Quebec, and she's the French lead for the grant. Jim Petrick, we just learned of him by accident through the CAFC, and he's a cancer scientist by day at the University of Guelph, and he's a fire chief at the Guelph Eramosa Fire Department the rest of the time, and he's on the CAFC Cancer Committee. Ariane Belanger-Gravel, another behavioral scientist from Laval University. Ivana Irwin, who's Deputy Fire Chief in Emergency Management and Training at Leduc. She's also a nurse, and she's on the CAFC Cancer Committee. Igor Yakovenko, another statistician. And then Alberto, who very kindly agreed to be our consultant. Miriam Akbari is our coordinator. Ting is one of my former students who's now a research assistant, and Hannah Bailey, again, another research writer. So the state of the science at the time that we wrote the grant, which was about a year ago, is that the epidemiology, although not perfect by any means, was not bad. And firefighting, as you all know, is a risk for cancer. Some studies detailing the mechanism, contamination by skin, ingestion, and inhalation. And the two groups that are most well validated are the PAHs and asbestos. But there are few intervention studies. All of the intervention studies at that time had small samples, poor design, and almost no studies on self-report of exposure, prevention, and decontamination, and no measurement scales in this area. Now, the state of this sector in Canada is important. Firefighter cancer is a key issue for the Canadian Association of Fire Chiefs and Firefighters. There's about 130,000 firefighters in Canada. About 100,000 of those are volunteer and about 30,000 career. And the IAFF is the largest union which covers the career firefighters. All provinces and territories have presumptive cancer legislation or the equivalent. So it varies though, between 11 and 19 cancers recognized, and it's always changing, and they're all different. There's some commonalities, but basically one list is in one province, another list is in another. Very recently, Sherry Romanato is a federal member of parliament, that's our equivalent to your Congress, introduced a private members bill. Now, private members bills usually fail because if they're not introduced by the government, then they certainly fail. If they're introduced by the governing party, they sometimes fail. But this was very different. It directs the Minister of Health to develop a national framework for firefighter cancer, requires research, education, and training. It's passed second reading now unanimously. So all of the parties got together and agreed on it. And I think that's something to do with the high esteem that firefighters are held in Canada, as they are in the States. So it's now referred to a standing committee, and it almost certainly will pass. And there will be a flow of some resources. We don't know how much or what it will be, but there will be a flow of resources on the federal level for this initiative. So why volunteer firefighters? Now, this is a picture of Dawson City firefighter, the fire hall in Dawson City, which is in northern Canada. As in the United States, the largest group of firefighters is in volunteers, about 100,000, between 77 and 83% of Canadian firefighters. Around 80% of the fire departments are fully volunteer. So we do have some career, some mixed departments, and then some fully volunteer. They clearly have the fewest resources, the volunteer departments, because they're municipally or county funded, they're rural, remote. Some of them are Indigenous fire departments. The municipal and county, they don't have the money for equipment. Typically what happens in small town Canada is they do fundraisers. You know, they have Sunday breakfasts to raise money for their equipment. There's no federal funding except for a tax credit for individuals. There's in the volunteer, of course, there's no union. The IFPP has been a champion of cancer issues in the career departments. These people are represented by CAFC, our partner, who raised the challenge of cancer. And they include a national advisory council of all the provinces. So they link in with all of the provincial and the territories and national affiliates. And Graham Pollitt has been a very effective lobbyist for this. He's the past president of the Volunteer Fires Association. He's on the CAFC National Advisory Council, and he's the chair of the Cancer Committee. So hats off to Graham. Firefighter preventing cancer. Our purposes are, of course, the long-term goal is to reduce cancer. Immediate goal is the proof of concept of the intervention. And we wanted to develop and evaluate a health information intervention to increase exposure control and decontamination in volunteer firefighters. We wanted to develop and evaluate the firefighters' exposure to carcinogen scale so we could measure self-report rather than just have a question or two. We wanted to actually develop a scale. That's what psychologists do. We develop scales. And in stage 2 of this grant, which the Canadian Cancer Society and the CIHR have not announced yet, there will be something of a possibility of large implementation studies. Because we're Canada, we're bilingual in French and in English, and so we're very fortunate to have strong representation from our colleagues at Laval. So in Project 1, in this funded grant, is psychometric evaluation of a firefighter's exposure to carcinogen scale. So we wanted to get content validity. We derived the items from the scientific literature and NFPA standards. It's reviewed by members of the scientific team and by the CAFC Cancer Committee. And now we're doing psychometric evaluation. We did some qualitative interviews at first and modified minor issues, trying to get the wording right. And now we're testing about 150 or perhaps 200 firefighters to look at construct validity, factor structure, interrelations between importance, behavior, intentions, and barriers, because those are the subscales that we look at. And any language differences, we'll look at test, retest reliability, and that's what our plan is for the psychometric evaluation. So the scale is 20 items. For example, wash your hands with soap and water before eating, drinking at the fire scene. So in each item, there's 4 responses that we ask for. Do you think this plays an important role in cancer prevention? And the second one is behavior. Did you do this when you performed firefighting duties at the last 3 working fires that you were at? And then intention, would you do this in the future if the resources were available? Because in the rural departments, oftentimes there are not resources available. And barriers, what are the barriers to do this specific cancer prevention task? And so the types of barriers we're asking about is lack of departmental resources, not our department's way of doing things, or lack of management support, lack of other firefighters support. It takes too much time, I'm physically stressed, I'm emotionally stressed, I did not know about this, I was not trained to do this, or other, and they're asked to respond to that. So the items from the scale are things like, and these they could be revised after our preliminary testing, but you can see that they're pretty standard items in terms of decontamination and exposure control. I won't go through each one of them. Just let you look at them. This presentation, if you write me, I'd be glad to send it to you as well. So this project 2 is the randomized trial, and we're going to do what is known as a cluster trial. So first of all, what you do is you recruit the department and you randomize by department. And we're going to be stratifying by province because there's differences across the provinces. That's like your states, differences across the provinces in terms of the emphasis put on decontamination and exposure control. Then we recruit the individual firefighters, and we have an immediate intervention versus a delayed intervention. Everyone gets the intervention, and that was decided on because of the political issues, because everybody would want to improve their cancer control, even though we're not sure that it has an effect. We have a minimum of 200 participants per arm, up to 800 participants. And you might say, well, why do you have so many? What a variation in that. And that is because in a cluster trial, we have to recruit departments. If we recruit a large department, we want to be able to make sure that we can recruit enough departments, a variety of departments. Some departments are very small, and in our clusters, there's no minimum number. And we'll do a qualitative study of a small sample to understand the uptake. And as we're planning for stage 2, and it's not yet announced, we'll clearly want to have some biological measures in stage 2. So in the intervention, not only what we do is 3 things. One is 90-second fire cancer health letter. So the idea is that health information sometimes is wrong, sometimes is written in a way that we can't really understand it, and sometimes is delivered in doses that are too big. I always like to say, I mean, how often do you notice that there are ads for Coke or General Motors? They don't advertise once. They advertise many, many times. So oftentimes you have to get the message across over and over and over again. And so what we're doing is we're looking at, in the 90-second fire cancer health letter, we have evidence-based information, a personal story, 7-item quiz on the topic of the letter with the feedback is automated, and then we get feedback on the letter. And we have an asynchronous bulletin board to discuss issues. And we're just working out the exact details, but it'll be firefighter to firefighter online support, because social support in any behavior change is really important. It'll be moderated by my staff, by firefighter investigators and other volunteers. And the whole idea is problem solving of decontamination and exposure reduction. Well, maybe this is too hard to do. How can you do it? You know, we tried this works, so on, so on, so on. And then a summary webinar course with certification by the CAFC. It'll be a 45-minute pre-recorded webinar. It'll be done by fire chiefs. So they'll be the ones that they'll be talking about different things, and then we'll have some video of the activities being done. And it's an idea of a summative exercise rather than providing new information. And we end with a knowledge and perhaps even an intention quiz and then certification. So this is a flow chart of the main study. As you can see, it's fairly straightforward. If you're a scientist, you see these flow charts all the time. We want to make sure that we follow the best scientific methods possible. So the curriculum, what are we going to teach? Well, we're teaching off-duty considerations. We're going to talk about worrying about cancer, talking to your doctor, self-accountability, fatigue, so on, preparing for responses, while responding, gross decontamination, dirty gear as a hazard, cleaning your skin, transporting gear, and fine decontamination, inspecting gear at station, washing equipment, cleaning helmet, and so on. So here's a draft mock-up of what it'll look like. As I said, that there's a short, less than 200 words piece of scientific information with a graphic. And then we tell them a specific things that you should do. And we ask for some questions if they score that, and that it goes right back to them with a score and a suggestion of what they might do in the future. And then there is the personal account, and then asking to evaluate this health letter. So the challenges are that, you know, we have to make sure that it's confidential. So the chiefs are involved in recruiting, but won't have access to any data or participant information because they have to be volunteer participation by the individual firefighters. We're going to be trying very hard to get better gender representation to recruit women as participants in the study, even though they're a very small percentage of the fire service, and also trying to get diversity and inclusion. French language, oftentimes in Canada, things are only done in English, but we really want to make sure that we have Quebec, which is French is the only official language, and New Brunswick, which is the only bilingual province in Canada. So we want to get people with diverse racial backgrounds. And so we'll be trying to recruit ethnically diverse. The Indigenous First Nations fire departments are going to be hard to recruit, and they're sometimes very small in remote areas of Canada. So there's no lower limit on the number of participants per cluster, and we'll make special efforts to reduce First Nations departments through the CAFC. Lots of limitations to this study. The self-report is the only measure. It's all retrospective. It's not real time. There's no behavior measures. Our scale has not been previously validated, except we're doing some validation as we begin our study. The intervention has not been previously validated, so we don't know if it works. And yet we're doing a fairly large randomized trial. And of course, there's no direct link to cancer occurrence in this study, so we're not measuring cancer. Of course, that would be very difficult, but there's not even any measure of biological markers. But that's something that we're looking at and beginning to talk about if we go on to a second stage. So the progress, we've got great team and excellent collaboration and partnership. We got the letter of intent successful and the grant was successful. We're in the midst of our psychometric study. The REBs are all done. A scale development is now being tested. The cancer fire letters are being written and reviewed. The course is being developed. The coordinator is hired. I got a very good coordinator who's an experienced clinical trials coordinator. And the REB for the main study has just been approved. So I want to thank you for your attention and your interest. For the partnership of the CAFC, it really was originated from the CAFC and couldn't be done without the firefighters. It's about firefighters. And we've had excellent support. Many of the, in fact, all of the scientific team I had never worked with before, and they're just incredible. It's a great team to work with. And of course, we want your future involvement in perhaps other studies, and also certainly from the group here in Miami. They've been fantastic and supportive of moving this project forward. Glad to take any questions. I see there's 3 things in the chat. Shall I read them?
Dr. McGrath, thank you. That was excellent presentation and progress on the study. So now is the time that we'd like to open it up for questions of Dr. McGrath about the study. So if any folks on our Zoom session would like to pop them into the chat through the Q&A function, we're happy to relay them over to him, to do so. Dr. McGrath, one of the questions I wanted to ask you while folks are queuing up their things, in the States, education for volunteer firefighters is a bit different than the traditional career firefighter. We know that our volunteers spend oftentimes when they meet is doing these types of educational and training exercises together. In Canada, are the volunteer firefighters have a sort of uniform or standard way of receiving education, or is it more dependent on the volunteer fire department to put those things together?
As far as I can tell, it's pretty dependent. I mean, there's 10 provinces, 3 territories, and the fire services are all under the different provinces or territory, and then they devolve down to the municipalities. So it's quite varied. There are schools of firefighters, but there's not necessarily a completely standardized curriculum, especially in this area.
Okay.
So it's very much up to the individual initiative of the fire department. And certainly I have limited experience. I'm not an old fire hand. And this is my first study in the area. I come from the area of using technology to deliver healthcare, and so this was quite new for me. It was initiated with discussions with the executive director. So
I share your same sentiment. When we started our firefighter cancer research, I did several ride-alongs with our various fire departments to get some insight, but definitely not a firefighter that can inform of the science.
Right. So here's a question: what barriers did you encounter in writing a grant for this research? Well, there were several barriers. The first one is assembling the team, and because I'm not a fire cancer expert, I don't know anything about fire. You know, I pass by the fire department. That's about all. And I go to their when I lived in rural Nova Scotia part time, I'd go to the Sunday breakfasts, and always be very glad that we had a fire department close to where our house was. But so assembling the team was important and very difficult, and that was the relationship with the CAFC was extremely important, and we found that is key to our development of this project. The methodological pieces are challenging. We trying to do a grant where you haven't had 3 or 4 or 5 grants beforehand doing little things to start off, but the call was for primary prevention and a proof of concept, but without a measure, without any curriculum that we have had tried that we could deliver to volunteers, which across the country, sometimes in small cities and towns. So we really are very those were the big challenges, and that's been really actually quite easy. The CAFC has been extremely supportive. Graham it was the one that pushed the CAFC to get involved in cancer, and now he's joined our team and chairs the cancer committee. But and finding a fire chief who was also a cancer researcher was amazing. And then we have a nurse trainer who's just been phenomenal in terms of the content of our scales and our content of our treatment. So it's been fun. I mean, if it isn't fun, you don't get it done. But it's been hard. So the question was: do you have plans to measure cofactors with known influence on cancer development? Diet, family history of cancer, shift work as examples. Volunteers may be more susceptible to the effects of shift work. And that's from Todd. And we, in this study, we're not measuring those things simply because we're not actually measuring cancer development in any sense. And so that's the difficulty that's why we're not choosing to measure that. There's also an issue of burden on the respondents, and you want to make it as simple as possible. And so we decided to focus most of our energy on the behavior around and their attitudes and what they see as the challenges in their in implementing any behavior around decontamination and reduction of exposure. Another question: are there standards concerning PPE, bunker gear decontamination in Canada? And by and large, we use the same standards. It's borrowed from your standards, and we use those all the time. These are not. These are more consensus that we should use them rather than you must use them in all cases. So that's the situation that we find in Canada, as far as I know. But you see, I'm not a fire person. I'm just getting introduced to this, but that's my understanding.
Dr. McGrath, we have one more question that's actually posted in the channel. I'll read it to you. It says, cancer often takes a long time to show up. Is there any effort to follow up with firefighters who are retired and measure occurrence of cancer after retirement? So,
certainly that's an extraordinary, that's a very good observation. And clearly that's a very important issue. And we're not doing it in this study. It's a small grant, small study with a specific purpose. We hope that this study will be the first of many studies, and we hope that we could begin to do something like what you've done here in Miami and developing a whole team with people looking at different areas. There's clearly so many issues in fire cancer that have to be looked at and examined. And without a whole cadre of researchers working very, very closely with the fire services, not just going off and doing their own thing as academics, but really working closely with the fire services. That's the only way we're going to begin to answer many of these questions. And I think that the center here is a very good example of really integration between the academy, the university, all of us academics with pointy heads and have to interested in publishing papers, and the fire services, who are much more interested in doing something for their firefighters. And we have to have that, really integrated. Another question that I just see here is, are there assigned health safety officers in the volunteer corps that review and assist in this educational project? In other words, a more permanent position per department to ensure standardization of education and implementation of data-driven preventive measures. And again, that's from Juan. And again, this is a very, very good point. In this study, we don't have that. And in general, there are some departments that do this, but it's not standard practice and it's not typical as far as I understand. So, the volunteer fire services are some departments are really, really well organized, really well-oiled machines. They're up on everything the latest. And other departments are scrambling because of their economic situation. Maybe they have a lack of there's a huge crisis in terms of aging out of the volunteer fire services in Canada. It's not because of fire services so much, it's because of the rural depopulation. Until COVID, the only way you could get a job in most places was to move to the city. And so that Nova Scotia, which I lived in for 35 years, is a good example, is everybody moved to Halifax, or some moved to Sydney, Nova Scotia, but everybody moved to the cities for jobs, anybody who was young. And so that is, you had the aging out. People in the volunteer fire sector tended to be quite old. They still have excellent training on fire specific things, but really lagged behind on equipment and lagged behind on some of these other issues. But there's huge exceptions. When you have leadership, and in some departments, the leadership was outstanding, and this would be a very important issue. In other departments, it just didn't occur. And so that the whole idea of working with this national association is to try and ensure that this becomes a national effort, even if the law and the regulations are provincial. You get some learnings across provinces and across between the volunteer sector and the professional sector. So I'm sorry, that's a long-winded way of answering a very good question.
That was a great response, Dr. McGrath. So a question that I have for you is about how we handle decontamination practices seasonally, right? With the volunteer fire departments, whether it's really cold months in Canada or very warm months in Canada. In Florida, we're very fortunate. We usually have very warm throughout the year, but I can imagine decontamination practices might be thought of a little bit differently, negative zero weather. So I'm just curious in formulating the team and starting conversations on decon and how it's assessed. How do we think about sort of seasonal variations, in different climates, such as in Canada?
Well, as somebody on the chat just said, extreme cold weather causes headaches for fire departments, and we don't know what happens really in a systematic way, but anecdotally, there's sometimes people will if it's minus 40 below and you're trying to put out a fire, minus 40, whether you use a centigrade or a Fahrenheit scale, is exactly the same. It is very cold, and your equipment doesn't work as well. And I once had a car handle break off when I tried to open my car door because it was 40 below. Metal becomes brittle. And anecdotally, you'll hear of firefighters huddling around the diesel exhaust because it's warm. And we all know what the diesel exhaust is a carcinogen. But you know, that when you're freezing, and so those things do happen. And we have not targeted that question, but we'll be able to analyze our issues in terms of geography, and we will be able to do that. We won't be able to analyze it in terms of it's not powered sufficiently to look at seasonal variations, but it clearly is a big problem. And of course, in Canada, we also get heat bombs. And in last year in British Columbia and Alberta, there were and in Saskatchewan, there were heat bombs where the temperature was 40, but it was above 40 above. And for extended periods of time, we had the one small town in British Columbia where they had the heat bomb, and it lasted for about a week and a half. And then it was ravaged by a huge forest and brush fire. So the town was destroyed after the heat bomb. So I mean, these issues, both extreme cold and extreme heat, are real issues in terms of decontamination, just because of in the extreme heat, there's going to be differences in the transmission of and the skin and the sweating and the volatile hydrocarbons are going to be much more difficult to control.
Yeah, that's a great point, and that's an excellent point. Are there any other questions from our attendees that you'd like to ask Dr. McGrath about the project or about Canadian firefighters? Okay. All right. So seeing as none, let me just say, Dr. McGrath, we're incredibly thankful for your time, because we know you're very busy and are incredibly passionate about this, and the opportunity to learn from each other. I think it's very important as we study firefighters and cancer that we look at it from all different angles, as you mentioned during your presentation, but particularly with our brothers and sisters to the north, because cancer doesn't discriminate on who it affects. And we're thankful to you and the research team in Canada for this opportunity to share information and to collaborate. So thank you, firefighters, for your attendance today during the seminar. Tara, is there any outgoing messages that you'd like to say before we close out?
Yeah, so actually I just saw someone in the chat. How can we contact Dr. McGrath?
Yes, well, my email is patrick.mcgrath, McGrath, at Dalhousie, DAL.ca. Love to hear from you.
Okay, I just wrote it out and posted it in the chat for everyone to have. And I think that is it. I just want to mention that our next seminar series will be on July 27th. It will be our very own Dr. Caban, and Paola will be presenting on UV light exposure.
Yeah, so we're excited to kick off the new year talking about how ultraviolet radiation exposure among firefighters potentially impacts skin cancer. And so our goal will be to kick off the new year talking about ultraviolet light from the Sunshine State. Wish you all a very happy, long Independence Day holiday. And thank you to our firefighters for keeping us safe. See you next month. Bye.
Thank you.
Thank you.